Hi friends, good evening. I am Dr. Vinay Bhumia again from Sanjeevani Super Specialty Hospital. And here before you is Mr. Prem Kumar. At around 8:30 p.m. in the evening on 23rd of April, I got a call from my veterinary friend Dr. Tina that one of my staff has become unconscious. So I told her to send him immediately. He was wheeled in a stretcher in our ICU. He was deeply comatose and very irritable. There was no localizing or lateralization signs, but on examination we found that he was not moving his left side properly. So we suspected it to be a stroke. In emergency, we immediately did a CT scan because there was no time. CT scan was normal. It was not showing any hemorrhage nor any infarct. But in our hospital, we have made a protocol that any patient of suspected stroke, if the CT is negative hemorrhage, is negative for hemorrhage, you can thrombolize this patient. So we advise the relatives the benefits of thrombolysis, intravenous thrombolysis. They agreed, and we gave him, according to body weight, 0.9 milligram per kg body weight with 10% bolus and rest in 1 hour infusion, about 70 milligram of Actilis. Next day morning, there was very less recovery. No doubt his irritability had settled down. He was responding to painful stimulus, but not very much recovered. So we did a MRI with detailed angiogram on 24th of April, and it was showing a complete occlusion of right internal carotid up to the intracranial region and even non-opacification of the right MCA, middle cerebral artery. So this was an extreme level of thrombotic stroke involving the entire hemisphere. But we explained to the relatives about the benefits of thrombosuction in such patients, but lot of time had passed and the cost was enormous. So next day we put the patient on antiplatelets, anticoagulants and other supportive medicines, and from third day he started regaining conscious level. Today he is able to walk also. He has come walking, he is sitting on the chair. His aphasia, he had a global aphasia, motor and sensory. Now both are recovering. His motor aphasia is recovered, sensor is partially recovered. And हाथ ऊंचा करो दोनों. Even he is able to lift his left hand, which was hemiplegic on that day. बस रख दो. नाम क्या है आपका? आपका नाम क्या है? आपका नाम बोलो भैया, आपका नाम बोलो. नाम बोलो. He is able to speak also, he is able to understand. So see the benefits of thrombolytic therapy in a acute stroke. Many centers, they do not thrombolize, but giving thrombolytic therapy is very easy in any patient of stroke if the patient has come in the window period. So I will suggest to all my colleagues, be open for thrombolysis, and sometimes don't waste time in doing MRI and then doing MRI angio, and because in the acute crisis, if you do a MRI, you are wasting almost an hour. So just do a CT scan. If it is negative hemorrhage, straightway thrombolize the patient. Only your clinical suspicion should be correct for stroke. Secondly, you should assess that there is not other thing, some other convulsions or epilepsy or some other reason of unconsciousness or not there. Or if the patient is conscious and having hemiplegia and has come in the window period, then you can easily thrombolize the patient. So these are because what happened in this case, due to thrombolysis, the microcirculation is saved. So today he will have a fruitful life. Neurological deficit will be minimal after 1 or 2 months, and he will be able to lead a normal life. So this type of benefit of thrombolysis should be given to all our patients. Thank you so much. Next, we have also investigated the patient for hypercoagulable states. Means we have done his lupus anticoagulant, we have done his antiphospholipid antibody, we have done his ANA, we have done his homocysteine, we have done his B12 levels, we have done his bleeding time, clotting time, everything. But luckily everything has been normal. So we have not been able to find out any reason for such young stroke. But many times this can happen because of the habits of tobacco and all. Atherosclerotic process can happen, leading to blockage of the major arteries. So this we can keep in mind, and we are now today discharging him and wishing him a speedy recovery. ठीक है ना भैया पहले से? See, he is able to understand. The sensory aphasia has gone. Motor is slightly affected still, but I suppose and I am hopeful that this is going to recover. Thank you so much.